29% of adults in San Joaquin County have hypertension, which is a condition that has been dubbed the silent killer by health professionals. High blood pressure is the leading cause of heart attack and stroke, and many people do not know they have this condition until it is too late. Management of the condition involves proper diagnosis and interventions, health-promoting behavior, being aware of signs and symptoms, and knowing when to consult a care provider or community health resource. Let's start with the numbers.
Here are the numbers. Normal blood pressure is less than 120/80. Elevated blood pressure is greater than 120 on top, 120 to 129 specifically, and less than 80 on the bottom. Stage 1 high blood pressure is 130 to 139 on top, or 80 to 89 on the bottom. Stage 2 blood pressure is greater than 140 on top, or greater than 90 on the bottom. So, when do you call someone about your blood pressure? If your readings are consistently at or above 160/100, call your clinic or your provider and let them know. And remember, if your blood pressure is above 180/120 with chest pain, difficulty breathing, or changes in speech or vision, that's an emergency. Call 911. This is where we want to be. This one needs help. Blood pressure around 180/120 with difficulty breathing, chest pain, or changes in speech or vision. That's an emergency. Call 911.
How to get and/or worsen hypertension.
Hey everyone, welcome to my mukbang. Today I'm going to be eating some of my favorite foods. I prepared myself a very special feast. I'll be eating a bowl of ramen noodles, lemon pepper chicken, an entire combo pizza, a can of Vienna sausages, a can of Spam, heavily salted potato chips, and for dessert, a platter of salt. This is my favorite dessert, and I like to add a bowl of soy sauce to dip my salt in, as it really elevates the flavors and brings the dish to the next level. And for my beverage, I have a bottle of alcohol to cleanse my palate and wash everything down. Lately, I've been thinking of smoking as a way to cope with my stress.
Apparently, they just... What the hell did I ever do? Okay. Which is one of the constitutions of renection, or obviously, early lane, you don't really have a lot to say, but with Croft, you can actually...
Lately, I've been getting a lot of headaches. I've been feeling lightheaded. I've been feeling short of breath, nauseous, and very fatigued. I feel like I live a pretty healthy lifestyle, but I guess not. I checked my blood pressure and it seems pretty high, so I think I should call my doctor.
At this stage of health, nursing management would be indicated. Nurses would assess blood pressure and symptoms, assess organs for damage, take labs, and assess medication adherence. For hypertensive emergency, interventions may include intravenous or oral blood pressure medications and other treatments if necessary. The next clip will go over ways to manage blood pressure outside of the clinical setting.
Taking daily medication like antihypertensives will help decrease blood pressure and improve your health. It's 10 p.m., it's time for bed. Getting your 8 hours of sleep will also help decrease your blood pressure and improve your healthy lifestyle.
It is important to be able to accurately take blood pressure to diagnose the condition and to monitor health status, so please watch the following tutorial video closely.
Before doing the blood pressure test, make sure to take no caffeine, do not exercise or smoke for at least 30 minutes. Empty your bladder and sit for 5 minutes. Back supported, feet flat, legs uncrossed. Cuff should go on your bare arm. Support at heart level. It's important to use the right cuff size. 2 small reeds high, 2 big reeds low. Take 2 readings 1 minute apart. Do it in the morning and also in the evening for a week. Then log the average. It's helpful to use a weekly organizer as well as setting your phone alarm to help with medication.
There are a variety of resources available in the community for people dealing with hypertension. San Joaquin Health, for example, has walk-in mobile clinics spread around the county for people to receive hypertension management care and education. In addition, 211 San Joaquin is a free service that people can access by simply calling 211. It acts like a middleman and connects people to clinics, health education programs, and other things like access to food, which is relevant to hypertension care. These resources are linked in the description. Stay happy and healthy.